I recently presented the results of our retrospective cohort study about the impact of perioperative chemotherapy timing on survival outcomes among patients with colorectal liver metastases. As we know, colorectal cancer is the third most common diagnosed malignancy in the world and the United States, and it was the second leading cause of cancer death in 2020 in the United States. Liver metastases develop in about 50% of all colorectal cancer cases, with nearly 20% of newly diagnosed metastatic colorectal cancer patients present with liver metastases at the time of diagnosis. Surgical resection is still the cornerstone of treatment for liver metastases from colorectal cancer. And there's studies showing the benefit of perioperative chemotherapy in improving progression-free survival and overall survival. But there is a lack of data in assessing the impact of perioperative chemotherapy timing on survival. So in our study, we had 5,646 patients with metastatic colorectal cancer and liver metastases. 61% were treated with adjuvant chemotherapy, and 39% were treated with neoadjuvant chemotherapy. We found that patients who were treated with neoadjuvant chemotherapy had a statistically significant better overall survival compared to patients who received adjuvant chemotherapy. The median overall survival was 48.6 months in patients who received neoadjuvant chemotherapy versus 38.6 months in patients who received adjuvant chemotherapy. We saw the same trend after performing propensity score matching for age, Charlson comorbidity score, and clinical T-stage and N-stage. The main limitation in our studies were, first, we did not have much details about the chemotherapy type the patient received. Second, there was a lack of details about other endpoints like disease-free survival and cancer-specific survival. Overall, our study showing that the timing of chemotherapy can be a critical element in treating patients with metastatic colorectal cancer with liver metastases. Further prospective randomized trials, of course, are needed to confirm those results.